Assalamualaikum warahmatullah and very good morning. My name is Noshaira binti Hashim and my debate topic for today, mental health children during pandemic COVID-19. The province knows almost the whole world imposes lockdown action on their countries.
Well, we may be going into lockdown, but we are certainly not alone. We've got a map for you that just shows how many countries are in lockdown.
During pandemic COVID-19, the government has implemented a lockdown a few months. There is no denying that the COVID-19 pandemic that has spread in the country since last 2 years has affected many parties, including children. Among the most worrying impact on children is their level of mental health. Compared to adult, children are easier to deal with mental health issues because they are still young to deal with the stress they face. Unbeknownst to them, parents who work from home are among the causes of stress among children. There are a number of stresses children face during this pandemic, including family problems, family pressure, and limited space. More worrying, if mental health symptoms are not addressed properly, can have more serious effects in the long run. Being mentally healthy during childhood means reaching developmental and emotional level as well as learning healthy social skills and ways to cope when there are problems. Mentally healthy children have a positive quality of life and can function well at home, at school, and in their communities. Mental disorders in children are described as serious change in the way children typically learn, behave, or handle their emotions, which cause difficulties and problems throughout the day. Many children sometimes experience fear and anxiety of exhibit destructive behaviors. If the symptoms are serious and presented as well as interfere with school, home, or play activities, the child may be diagnosed with a mental disorder. Mental health is not just an absence of mental disorder. There are several causes of mental problems in children during the pandemic, school closure, and its impact on child mental health. School is an important phase in a person's growth and not just in terms of academic alone. In school, children forge friendship and support systems that serve as a step for them to meet social-emotional needs. Children often choose to connect with the world around them independently and prefer to spend time with friends. However, as a result of the transition of the learning system to the virtual world due to COVID, their social interaction were disrupted. An important stage in their development is now shifting to virtual space, which harms their emotional health. This is because they can no longer socialize like the usual situation at school. As a result, the feeling of loneliness has taken along with the lockdown start. The lack of emotional support from teachers and peers has caused many students to feel isolated and alone. During this pandemic, most of the children have to be at home with parents and other siblings. Some of those who live in small houses have limited space, so it affects children because the children cannot move freely. This condition makes children uncomfortable, which can be emotionally disturbing and stressful. In addition, children who have to face the new norm of learning online at home also face pressure from parents. Sometimes there are a handful of parents who unknowingly put pressure and force the child when the learning season goes on at home, resulting in the child being depressed at young age. Many parents, the effect will be the child will be embarrassed, hesitant, and apprehensive when he goes to school later. Conflict involving parents at home can also be stressful for children. Without realizing it, this condition can change children's behavior into depression and into irritability. Children have limited cognition, so they are more prone to mental disorder when faced with stress than adults. They will also slowly become restless, panic attack, pounding, and most afraid is depression until they start thinking of suicide. Parents need to keep in mind that suicidal individuals actually have a history of experiencing untreated childhood mental disorder. If parents are aware of their children's mental problem, parents need to help their children. Parents have a variety of roles in their children's mental health. Parents need to be aware. We all know that today parents are overworked and don't realize they are ignoring their children's problems. They were more likely to hide their thoughts and finally succumb to sadness since they didn't know who they were friends with, didn't ask about their days, and didn't care about their difficulties. As a result, parents should pay more attention to their children's emotions. Children's mental health is critical to their long-term happiness. Second, immerse yourself in thought and feelings. Parental instinct and a mother premonitions are among those often mentioned in the process of raising children. This special case if parents is an advantage in reading the minds of children. Sometimes through the movement of children, parents can already guess what in their minds of children. In addition, note the change in behavior and word order and children's speech. If children suffer from stress or depression, there will be change in their speech and behavior. If there are signs of depression can immediately see a specialist. Third, immediately take the child to see a specialist. Some parents are ashamed to take their children to see a psychiatrist. Being single and receiving treatment from a psychiatrist does not mean that a person is insane. Meeting a specialist is the best first step in getting treatment for those with mental health problems. Patients will be given an appointment as well as medication if necessary. If parents notice different behavior and children seem depressed, immediately take children to see a specialist. Parents are the closest people to persuade them to seek a treatment. After declaring COVID-19 as global outbreak in March 2022, WHO urges all countries to take necessary and strict measures to reduce virus transmission. Physical distance, school closure, living in home, and work from home, along with local and international travel restrictions, have been implemented by many countries. The effect of these measures affect all communities and their members. School closure, physical imprisonment, and staying home can affect a child's mental health in the short and long term. Research has stated that children living in homes during pandemic are more likely to develop adjustment disorder, ASD, sadness, attachment, distraction, irritability, and fear. They are also at higher risk and suffering PTSD after an outbreak. Parents or guardians advised to be there for their children by communicating, bonding, and performing activities at home to facilitate and prevent any psychological issue the child may be facing reunion. When the epidemic continues, it is important to build relationship and be resilient community to mentally care for children's health. It is equally important to be prepared, provide support and care to the children encounter effect of the COVID-19 pandemic. And that's all my debate topic for today. Assalamualaikum.